get it down to 100. Happy to tell you that mine is 70.
Bragging.
Yes, right. Cardiac. What happens if you go into the hospital with a chest pain and you're sweating and your blood pressure's low and they say, well, this looks like you've got a coronary. We can do a test called troponins. And troponins are a substance released from the cardiac muscle when the cardiac muscle is damaged. Excellent test. It's accurate within an hour or two if you actually have myocardial or heart muscle damage. So troponins is something the emergency room does right off the bat. The last one for blood is we can check any drug, any toxin, anything you can think of that can be checked in your blood. If you want to know what your blood level is of the codeine you're taking or the blood level of the antibiotic you're taking, it's easily measured in a competent, sophisticated laboratory. All right, and we'll move on to procedures. Now, in the old days, all we had were x-rays. And I can well remember those old days because we had x-rays for bones, for chest x-rays, for gallbladder studies, for kidney stones, kidney function. And we had fluoroscopy, which we could use to see. I did an awful lot of fluoroscopy in my younger days, where we could see the heart action. You actually see the heart beating, you can look at the size, the shape, and how it beats, and it's very, very helpful. But you expose the patient and yourself to huge doses of x-ray. So that has been replaced by ultrasounds, and we'll get to ultrasound a little bit later. However, we still do upper and lower GI series with barium, and that's done under fluoroscopy as well. You all know about electrocardiograms. We can do those resting. We can do a stress test on the treadmill. We can use, if a person is not capable of walking on a treadmill, there's a medication called adenosine. Adenosine can be injected intravenously, and it causes the heart to act as if it were running on the treadmill. We do radioactive nuclear scans now to actually look at the heart muscle to see if the heart muscle is acting uniformly or if there's a deformity due to a weakness or to an area which is non-functioning due to a previous heart attack or to a present heart attack. This is extremely valuable and highly technical. Also, we do electroencephalograms that you know are just brainwave studies. You can learn an awful lot from electroencephalogram, but there's an awful lot that you can learn much better by imaging techniques, which we'll come to now. Now, CAT scans, I want you to picture in your mind a loaf of bread right out of the oven. And if you put the loaf of bread in the slicer, you now have 20 pieces of bread. Now, if you put your body into a CAT scan machine and you CAT scan your lungs, you now have lungs with slices all the way down. And you can take these slices from 3 millimeters, which is nothing, to as wide as you want. And you can see when you put these all up, when you see on the TV and these medical shows, they have banks of x-rays. They're all CAT scans, and you can look at the CAT scan from the top to the bottom. If you ask me what's the greatest advance in medicine over the last 30 years, I would say imaging techniques. We can look inside of you any place and everywhere and see down to slices like that. It's an extremely wonderful thing to have. So and we can CAT scan anything from the brain to the big toe. Go ahead.
What is the difference between a CAT scan and a PET scan?
A lot of difference. The PET scan is the injection of, well, let's put it this way. A CAT scan is looking at anatomy. What is the anatomy? A PET scan is looking at what is the function of the part. And PET scans are principally used in brain studies because certain areas of the brain pick up certain chemicals. And then if you do things, think mathematics, many things you can do, it changes what you see on the PET scan. So the PET scan is really a study for function rather than for anatomy. And PET scans are extremely expensive and only done in research laboratories. I don't know of anybody who uses the PET scan for clinical uses. Of course, I'm old and I may not be up to date. All right. And then, of course, going from the X-ray, which we don't like to expose people to X-rays for many reasons, principally because of blood problems, leukemias and Hodgkin's and things like that. We go to the MRI, and MRI means magnetic resonance imaging. And this is an absolutely fabulous instrument which it costs billions to set up because it requires its own building, as well as the machinery within the building. But it doesn't use X-rays, and it is able to look at soft tissue. X-rays look at bones. MRIs look at soft tissue. They can look at the brain substance. They can look at your shoulder and pick out every tendon, ligament, capsule, whatever you want to see. Or your elbow if you're a left-handed Sandy Koufax pitcher. They are wonderful things to have and to use appropriately. For example, just to give you an example about this, if you go into the ER with pain in your belly, they'll probably CAT scan your abdomen and you can pick up the diagnosis of appendicitis. But you can also do the same thing with an MRI. You can also do the same thing with an ultrasound, and we'll come to that next. But anyway, MRIs are a wonderful, wonderful thing for soft tissue, muscles, tendons, ligaments, lungs, abdominal contents, whatever. Yes?
I wanted to ask that, you know, you've had a hip replacement, and I don't know about the knees or whatever, and they don't want to take an MRI. Is there any time they can after a period of time,
No.
or they just never?
No, the metal
That
interferes
stops.
with the magnetic resonance. Can't do that. But they can do the other hip.
Great.
Yes. Where?
Back
There, Jim.
How dangerous is a CAT scan or an MRI to the person, the individual?
I don't think there's any danger to an MRI, except for claustrophobic people that might have a breakdown inside that tank. In an MRI, they have to kind of put you lay down on a table, and the table moves into a tunnel. And you're in this tunnel, and you got to be in there for 15, 20, maybe 30 minutes sometimes. And the tunnel is all around you, and there is a microphone in there, and they can talk to you, and you can talk to them. But if you have any degree of claustrophobia, they better do it fast.
Well,
the other, you said the CAT scans, of course, have X-ray. We don't like that.
One other question about that. How about implants? When you're going through a CAT scan or MRI?
Implants won't make any difference in a CAT scan, but in an MRI, if it's metal, it's going to throw the whole machine out of whack. You want to do that. Okay, ultrasound. Everybody knows about ultrasound sonograms for pregnancy, picking up the sex of the baby, for looking for all kinds of things. Ultrasounds, as I said before, are excellent for gallbladder disease. You can see the stones. It's just marvelous. The appendicitis is good. A lot of people get sent for ultrasound of their carotid arteries. They can look into the inside of your carotid arteries and see if there's plaques in there, anything interfering with the flow. They can do the same thing with veins.